Welcome to Health for Life, your trusted source for health and wellness insights, proudly presented by Vitruvian Health, the comprehensive healthcare system serving Northwest Georgia and Southern Tennessee with leading entities like Hamilton Medical Center and Bradley Medical Center. We're dedicated to keeping our communities healthy and thriving.
Today we're talking with Dr. Arif Ali, board-certified radiation oncologist and medical director of Peeples Cancer Institute at Hamilton Medical Center. Dr. Ali, welcome to the show.
Yeah, thanks for having me.
So today we're going to talk about lung cancer and the latest in clinical trials at Peeples Cancer Institute. So they are now performing clinical trials for locally advanced inoperable non-small cell lung cancer. Could you tell us more about that?
Yeah, so that's a lot of words for sure. But we're excited to finally be able to offer, this is the first of many trials that we're opening in collaboration with the Winship Cancer Institute of Emory University. And this particular trial happens to be a lung cancer trial, non-small cell lung cancer. It's an interesting trial. We're really excited about it because of the technology that it offers. It's bringing a combination of treatments together, if you will, that we likely wouldn't be able to offer outside of a clinical trial. And it's very promising. There's always, for lung cancer in general, there have been two sort of major types of radiation. One is called SBRT, or stereotactic body radiotherapy, and the second is sort of conventional chemotherapy and radiation. And this particular trial combines both of those technologies. Typically, SBRT is a very focused dose of radiation, almost like like a laser beam, if you will. It's a very tight radiation field right around a nodule, right around a small lung cancer nodule, and it's super high doses. And the local control, if you will, the chances of this coming back, or the local control, is probably greater than 90%. So it's very, very effective for treating these small tumors. But we've never really used it for sort of larger tumors or tumors that have spread to lymph nodes kind of within the chest. Typically, historically, for lung cancers that are a little bit more advanced, where there may be lymph nodes in what's called the mediastinum, which is the area between the two lungs and the chest, we would use the combination of chemotherapy and radiation. And the radiation would be the conventional radiation, so maybe it would be about 30 treatments, just a little bit every day. Whereas the SBRT would get very large doses over, as little as 5 treatments or even 3. Conventional radiation is more like 30, a little bit of radiation every day, just so that the normal tissue can better tolerate those doses of radiation. And the chemotherapy, of course, sensitizes the cancer cells to the radiation, makes it more effective. And so we have, with the conventional radiation, we haven't had as great a local control as we've wanted as a field, And so this particular trial asked the question, well, we know we have great local control with this, high dose, high technology treatment called SBRT. What if we had a lung cancer, what if we treated the primary lesion with SBRT and then just treated the lymph nodes with the conventional chemotherapy and radiation? And this trial is asking the question, is there a benefit to that? And it's a phase 3 trial, meaning that we already have phase 1, phase 2 data indicating that it's safe, and there are indications that it is beneficial, actually, at least compared to historical trials. There has been demonstrated benefit in the phase 2 trial in terms of local control. And so, this is a trial that's available through hundreds of institutions across the United States. I think I looked at a map recently, like, Chicago has more than 40 or 50 different institutions, just a lot of, or at least that Midwest area, a lot of institutions that are offering it. Up in the Northeast as well, there's, a ton of institutions. But if you look in the South here, there's not a lot of availability for this trial. When I looked at the map, when we're trying to select which trials to open, this trial is available at Emory. I think it's available, further south, like maybe in Noonan. But going north of Atlanta, we're really it. This is kind of a big empty region, and we're kind of right in the middle of it. And so it's not available in Chattanooga, at least not right now, or to the east or west of us within the state, or even some surrounding states. Again, it's a very promising technology, and we're excited to be able to offer it. But more so, it's needed. We need to have these sorts of clinical trials available in this region because we just have not had that, in the past.
What's like the actual science behind targeted radiation?
Well, so the targeted radiation for this trial again is that SBRT, and we use a lot of technology to really use a small radiation field. Typically, in the past, we've had to use a large radiation fields because patient's breathing, a tumor is moving up and down. We know that it's in there somewhere. But because it's moving all over the place, in the past, we've had to use a large radiation field because we're just not able to specifically target the location. Nowadays, with the technology that we have at the Peeples Cancer Institute, and the equipment, we're able to more or less track the motion of that tumor. We can watch the motion of that tumor when we do the planning scan. And so we know where that tumor is going. And because we have that greater confidence in the location of the tumor within the breathing cycle, we can shrink that radiation field down and make it super tight. And what that means is that we're doing high doses of radiation just to the tumor, and then we're able to miss normal tissue that might even just be millimeters away or centimeters away. So all that allows, by using this high dose and focused field, allows greater local control with potentially less side effects.
Why is it that approach is so significant for that group of patients?
Well, for early stage lung cancer, we've had great results as a field for just these small isolated nodules. And technology is advancing every day, and we're incrementally having benefit for the more advanced cases. But the more advanced cases are where we really need to focus on, where we could really do better. And this is just one aspect of kind of pushing that frontier of looking at different technologies and applying different technologies that are available to help improve the local control, improve the survivability of these sort of these more advanced lung cancer cases.
How would these trials be monitored?
So there are several levels of oversight for these trials, and I always tell patients it's like that is one of the benefits of many of being enrolled on a clinical trial is if you were to just walk in at any average community center, you're going to have your physician that's doing the plan. You might have a radiation oncologist, medical oncologist, and there may be a tumor board, and all that is great, and it provides, provides great care. But on a clinical trial, there are several levels just above what's in the institution. So just even within Hamilton, clinical trials are reviewed by the Institutional Review Board or IRB. There's also for our clinical trials here, the hospital and Peeples Cancer Institute has dedicated funding to employ a dedicated nurse navigator specifically for clinical trials. So that means that any patient on a clinical trial gets their own personal nurse navigator that will help with all these appointments, that will help, coordinate all of the scans, make sure that things are moving along in a timely manner. I mean, we've already enrolled one patient on this clinical trial, and our nurse navigator is literally talking to this family, every day, at least so far. And so that's the design, is really to make it as easy as possible to also make sure that things get done in a timely manner and nothing is missed. And so that's at the institutional level. Above that, this trial is open in collaboration with the Winship Cancer Institute of Emory University, and so you have Winship Cancer Institute resources, clinical trial resources that are providing oversight of the clinical trial and the patient. And so what that means is they're looking at the patient's chart, they're looking at the radiation plans, the chemotherapy plans, they're looking for any sort of possible discrepancies. And then beyond the Winship, beyond the Emory level, there's also national oversight. So on this particular trial, we create a radiation plan, and we had to send it off to what's called central review, which is in Philadelphia. There's a center in Philadelphia that kind of has national oversight of this trial. And so there were additional radiation oncologists or additional physicians that were looking at this particular trial all the way in Philadelphia to make sure that everything is exactly according to trial, and to make sure nothing is missed and everything is basically in alignment with the clinical trial goals. So with so many eyes looking at a patient, patients should be assured that everything is being done exactly as it should be done and exactly as it would be done, in any other institution that has this trial available to them.
Honestly, that does sound very comforting. To have such a big operation and so many eyes on it at all times. No,
for sure. And if it were, if I had cancer, I would be looking at clinical trials as well. I do believe they're very important. It's very high quality care, but it gives you access to that next level, the frontier of technology that's available.
It is inevitable that somebody listening right now might have lung cancer. And if they're interested, how could they get started with this process?
So, we have to kind of get a hold of the patient before they start treatment because that is one of the criteria for the clinical trial. If someone's diagnosed has a new diagnosis of lung cancer, call us as soon as possible. We'll get you in within a day or two. And we can, even if the patient doesn't live around here, well, we can at least do a consult and kind of talk about the options and talk about if they would be eligible for this trial or not. It may be something that, that we have resources available to us. We will work with the patient and try to make it happen if they're interested in enrolling on the trial. If they're not eligible, well, then that's fine. Then, if they're not in the area, then they can go back to their community and at least they tried. At least we did the evaluation. So I would say if someone is diagnosed with lung cancer, doesn't hurt, just give us a quick call. We'll get you in a couple days, 1 or 2 days, and hopefully be able to provide some options. So if patients are interested in just getting a quick consultation for possible clinical trial options, they can call us at 706-272-6060. And then, again, this is the first of many trials. We plan on opening trials fairly soon for breast cancer, prostate cancer, rectal cancer, head and neck, some of the brain tumors as well. So give us a call, and we'll be able to tell you if we have any clinical trials available for your particular diagnosis.
That wraps up today's episode of Health for Life. Thank you, Dr. Ali, for helping us learn more about the important cancer treatment that is provided through clinical trials at Peeples Cancer Institute at Hamilton Medical Center. Thank you for listening to Health for Life, a presentation of Vitruvian Health, formerly Hamilton Healthcare System.
This program in no way seeks to diagnose or treat illness or to replace professional medical care. Please see your healthcare provider if you have a health problem.